Mm-hmm. 11 people. Aloha Friday, everyone. Thank you for joining us today. You can hear me. Just give me a quick thumbs up. Awesome. Putting folks into the room. So good to see some familiar faces. Thank you so much for joining us today. Just as you're coming in, let's get to know each other a little bit. Feel free to drop your name inside our group chat. Introduce yourselves, which community or organization you are wearing your hat on today for, which island maybe. And then also one or two of these things. Do you have any cool, fun plans for this weekend? And then also what brings you here today? Just give a couple more minutes. Aloha, Tony. Thank you for joining us. Nice to see you again. Hope the weather is nice there on Big Island. Aloha, Dana.
Good to see you, Mona.
Good to see you too. Happy Friday. Hi, Jane. Hi, Chris. So good to see you, Jennifer. Okay. Well, folks are going to continue to trickle into the room, but we'll go ahead and get started. I want to make sure I honor everyone's time today. It is a Friday, so thank you for spending your Friday here with us. But yeah, let's go ahead and start this.
Hey. Hi, everyone. Thanks for joining. I'm Janna Hoshide. I'm the AVP of Workforce Development for the Healthcare Association of Hawaiʻi. If you're not too familiar with Healthcare Association of Hawaiʻi, we are a trade organization. We represent 170 healthcare members across the state. So all of the hospitals, long-term care, assisted living, home health, and hospice. And so for our members, really workforce is a top priority. I also wear another hat as the lead of the health sector partnership. And so I'm excited because we have released our third workforce report, and so want to kind of share those results with you. The report is broken up into the data as well as our workforce initiatives. Okay. So we started back in about 2018, bringing together kind of interested parties with the whole purpose of trying to better align demand with supply in healthcare. And so we first needed to understand what were the open positions or the demand in healthcare. And our primary focus is non-physician positions. And the reason being is that JABSOM and AHEC do a really good job quantifying the physician need. So in 2019, we released the first workforce demand report that quantified about 2,200 open positions, mostly entry level. In 2022, we had our second report, and this was during the pandemic time. So we saw a significant increase, so 76% increase in the open positions. We also added a neighbor island breakdown at that point. And so we recently released our third report, our 2024 Workforce Demand Report. We added more professions. And just want to say a quick thank you to our sponsors. Okay, so here are some key messages, some takeaways, and I'll cover through them through the various slides, but just wanted to frame it up for you up front. And so, overall, we are seeing a decrease in the vacancy rate. So that is very positive. So vacancy rate is open positions over the total number of positions. And so because of that, and in certain areas, we are seeing very positive impacts of the workforce initiatives. However, we do know that our population and our kupuna, the kupuna population we have here in Hawaii is increasing. And so because of that, we know that the demand will continue to increase as our kupuna need more health services. And so I think it's very important that we continue to invest in growing our local talent, and especially with a focus on entry-level positions, nursing, and imaging. So this is just to show you and for reference, because you will get the slides after this webinar, just to see the 94 positions that we surveyed. And then in terms of changes between the 2022 survey and 2024, we added 5 new professions, and you can see them here: nurse management, psych aid, licensed mental health and substance abuse counselor, and then broad categories for food service and environmental services. And so you can see that by adding these professions to the survey, it increased the total number of positions by 3,600 and close to 500 open positions. And so we found that these professions, in terms of their openings, are mostly found in hospitals, skilled nursing facilities, and assisted living facilities. Because of the new professions that were added, and also happy to report that we had 2 very large federal respondents that were new to the survey here. And so that's great because it means we're getting much more robust data. What's a little bit challenging is that getting that apples to apples comparison. And so from a total view that includes the new professions and new respondents, we're seeing a total of 4,669 positions that are open in healthcare. But when you look at it on a comparable basis, so taking out those new professions as well as those 2 new federal respondents, we are seeing actually, fairly similar number of openings, about 38 openings down previously, down from the previous survey. Again, as I mentioned, what's great is we are seeing a decrease in the vacancy rate. And so in 2022, there were 17%. We had a 17% vacancy rate, and now we're seeing that reduced down to 14%. And so that means that the total number of positions is growing, but we're actually able to fill more of those positions. So very positive news there. Okay, so here are some data slides. Just wanted to share some of the categories that we surveyed. And so you can see on the top, we have categorized the professions by various categories, such as nursing, patient care. You can see the name of the profession. We also are surveying on the difficulty to fill. And so a lower score here means it's more difficult to fill that position. We have average turnover rate, filled positions, and open positions. So filled and open equal the total positions, and percent open is the vacancy rate, or the open positions over the total positions. And so in our survey overall, we like to share professions that have 30 or more job openings. And so you can see them here on the list. What's interesting to note is that out of those new professions that we added, 4 out of 5 of them made them to this kind of high number of opening list. Also, those who emerged and came on, so having more than 30 openings, we're seeing occupational therapists and medical lab tech, It's interesting because those professions kind of fell off of our top 30 list and then now are added back. It's good that we are seeing some impacts. So some of the professions where the needs are being filled, wanted to point specifically to surgical instrument tech and surge tech. And we know that our hospitals, such as HPH, they've developed their own programs and are training folks in filling those jobs. Okay, so another view, this is the comparative view. So an apples to apples comparison. And if you look down at this red box here, what we've done is we've dropped down the new professions as well as the federal respondents kind of below the total line. And then we can see the various professions and how those job openings have changed through our various surveys. So for example, on the top, you can see that last year, our RN or nursing openings were close to 1,000 at 999, and now have reduced somewhat to 904. On the opposite side, you can see an increase in our CNA and our nurse assistant positions. And so I will cover more about this in the next. We also have a breakdown by island. And so it is good to see that for Oahu, Maui, Molokai, and the Na'i, we are seeing a decrease in that vacancy rate. So that is very positive. But an increase for Hawaii Island and also Kauai. And so you can take a look at the report. We have much more detail in terms of each island and the top professions needed for each island as well. By care setting. And so it's not a surprise that really hospitals have the most job openings, so close to 1,600. Next are our skilled nursing facilities. So they have 864 openings. Our skilled nursing facilities are the only care setting to have an increase in their vacancy rates. You can see it went from 18% to 23%. And we think that that is really because of the increase in our aging population needs. Also to note, home health has the largest vacancy rate. Although this is a decrease from our last survey. So in 2022, the vacancy rate was 39%, so close to 40 positions, 40% open positions. And that has reduced slightly to 30%. So also looking at our aging kupuna, these are some slides that show our Hawaii population growth of those who are 70 or older. So you can see between about 2015 and into 2050, that population is going to double in size. We also know that we have a shrinking working population. So those that are 18 to 64, that population is actually declining. And when you put those two factors together as a ratio, so those who are working age to every person who is over 70 years or older, in 2020, the ratio was 4.5 individuals per kupuna. But as you look at 2050, we dropped down to only 2.7 working individuals per kupuna. So we knew this was coming. We are starting to see this in the data in terms of increased healthcare needs and therefore increase in positions. And so when you look at the skilled nursing facilities, they have close to 1,000 open positions and a huge increase in need for the certified nurse aides, as well as the registered nurses. We are seeing a slight decrease in LPN, and I think that's because of participation in our glide path, which I'll share more about. Okay, so really when we look at what are the highest need professions, you can see on the 2024 column, again, certified nurse aides and nurse aides, close to 1,000 openings. We are seeing some headway with nursing coming down slightly. And then we're seeing an emerging trend in imaging professions. And so we're hearing this from our hospitals. They are really struggling to get enough rad techs We also do not have a local program for ultrasound techs here in Hawaii. So that becomes a high priority focus in 2025. But you'll see these themes overall in terms of entry-level positions, nursing professions, throughout kind of the initiatives that we have. And then this year we'll have a focus on imaging. Okay, so want to shift and share a little bit about initiatives, but first talk about some alignment, structure, and a little bit of foundational pieces. So wanted to share some alignment with Hawaii Workforce Funders Collaborative and the most recent report released, because I think you can see by the challenges listed and the recommendations that we have a lot of alignment between our work. And so challenges, it's not a surprise in terms of having job availability and a good job that can sustain a living here in Hawaii with our high cost of living, and challenges in terms of job quality overall, flexibility for those jobs. That's coming up in terms of participants wanting part-time and different flexibilities. We know there are geographic disparities, so neighbor islands have fewer jobs and training programs. Training misalignment. We see this a lot as we're in the nitty gritty working through these pathways and the programs. And so a lot of work here. We also know that there is systemic stress, right? So economic pressures with our high cost of living and barriers in terms of getting into the workforce for some folks who may not have had these opportunities in the past. And then we're lucky in terms of sector strategies. We have a very strong sector partnership in healthcare. But in terms of the recommendations in the report, I'm going to touch upon them throughout the presentation. Really, our work efforts definitely align with these recommendations. Really expanding work-based learning. You're going to see that in the high school certificate programs, sector strategies. I will talk about lifelong learning and reskilling. So we call this a glide path where there are stackable credentials. And so I'll talk more about that. And then career navigation. So I will talk through, especially for our high school students, kind of the additional support and wrap services they need to actually transition into the job. And then, of course, it's very helpful if we can all coordinate together in terms of a unified workforce sort of framework and a goal. Okay, so for those who aren't familiar with sector partnerships, this is a model widely recognized, especially in grants. So for those of you who are familiar with the Good Jobs grant, it's a $35 million federal funding grant. It has a requirement to have a sector partnership. And so a sector partnership, it's really industry led. And this is different because I think for some programs, a lot of times we're hearing our education partners leading some of the workforce efforts. But for the sector partnership model, it's really industry leading and then really working closely with community and education partners in order to meet workforce development needs. And then big thank you to the conveners, so Chamber of Commerce as well as AE Consulting. They really are phenomenal partners that really make the sector partnership work. Okay, in healthcare, we have had our sector partnership for, I think, since 2018. So we have recently transitioned into 3.0 of our sector partnership, and that is really to bring in subsectors. And as we know in healthcare, we're so closely connected across the continuum of care. And so what happens in the hospitals definitely affects long-term care, or what's happening in EMS affects the different care settings as well. So it's important for us to understand challenges in different subsectors and how they might affect others across the continuum of care. We're also hoping to build a community of practice where we can learn from one another and then build stronger advocacy for healthcare overall. And so you can see here, I function kind of as the lead of one of the subsectors, and we folded in and brought in many other subsectors. It was really nice at our last meeting. We had a update from dental, and dental has felt like they haven't been as much at the table for these broad healthcare conversations. So they were really grateful to be in this subsector model. At HAH, we also have a workforce initiative steering committee for our subsector. You can see Jason Chang is the lead. And we have representation from our various membership. And really, they help to drive some of the strategy and the priorities that we work on. Okay, another foundational piece is we know that Native Hawaiians and Pacific Islanders are underrepresented in healthcare. And so here's some of the data in terms of the occupations. We see it's challenging because there is only good data for those who identify as Native Hawaiian or Pacific Islander alone, so one race. And so that is 6% overall participation. But when we look at our Hawaii population in terms of that same designation of Native Hawaiian or other Pacific Islander alone, we see that our state population is at 11%. When we add up in terms of those who identify as part Native Hawaiian or Pacific Islander, and so 2 or more races, then we're looking at about 27% as our total population. So we know this is incredibly important because if we don't have equitable representation in healthcare, that can lead to access to care barriers, right? And so it's extremely important and is a high area of focus for HAH and the Healthcare Workforce Initiative to have equitable representation. Okay, so on to our workforce initiatives. And I love sharing this because these are our participants. So first, want to start with kind of the end state. What are we trying to work towards? And it really is, you've heard it as maybe a K through career pathway. We really want to focus on the entire pathway from elementary all the way up through a very robust career in healthcare. And so I've integrated here some of the key aspects from P20 in terms of experiences for students along that career journey. And so hoping in elementary, they start having awareness and exposure about healthcare. And then in middle school, so this is a high area of a focus for us now as we're trying to really help those 8th graders explore healthcare so that they can choose health services pathway when they get to high school. At the high school level, we are implementing certificate programs. There is the health services CTE pathway structure in high school, so they are already on a health services pathway. And then from high school, we know that folks can go directly into post-secondary, but we're also trying to strengthen and expand that pipeline directly into employment. So from high school directly into employment, and then with opportunities for a glide path. So a glide path is an earn and learn progression. It means that employers are working closely together with education partners. And so they're able to manage and modify the schedule to accommodate work and school. In healthcare, it means that hands-on clinical training is done at the place of work and that there are wrap services to support both on the work side and the education side. And also it can utilize employee benefits overall. And so on the education side, we're looking at, that means strong career counseling and navigation. We want those credentials to stack. And so when we're looking at a CNA and CNA into LPN and LPN into RN, it is fascinating that the different UH community college campuses sometimes have different requirements, prerequisites. Sometimes those credentials don't stack along the way. And so that's really what's needed to make a very robust glide path. And then, of course, credit for on-the-job experience or learning. So that's kind of our end state that we're looking to achieve. In terms of our strategies and our initiatives, again, high focus on entry level. So we're really working to expand that entry level health certification pipeline. That means working both at the high school level to train folks and get them into jobs, as well as the adult population. And then our second strategy is working to attract and retain folks through those glide paths. And so we know in Hawaii, it would be very challenging to stay at an entry level salary and be able to maintain a living here in Hawaii. And so we know folks need opportunities to progress their salary. And so that's what we are looking to achieve in a glide path. And so I'll share about the CNA Plus to LPN glide path, as well as new glide paths that are being created. And for nursing, we really work to expand transition to practice programs. So really supporting those new nurses when they come out of the program with a robust residency program, and then transition to specialty programs. And I'll talk more about this. And a lot of this effort is really led by the Hawaii State Center for Nursing. Okay, so you'll see that the colors correspond to the strategy categories. I also have a numbering system up here so you can follow along. But a lot of work on career awareness and attraction. So again, as I mentioned, students are selecting their health services, their pathway in 8th grade. The pathway that they will be in high school. And so there are 13 CTE pathways within the DOE system. Health services is one of them. We're currently getting about 12% of the student population. So you can see, based upon our job openings, we really need to expand that and attract more students into the health services CTE pathway. So we did a pretty phenomenal project with Center for Tomorrow's Leaders and the Waipahu High School students. You can see their picture here. We asked them to do a market research project for us to look at, okay, how do 8th graders through 12th graders make decisions about careers? What sort of information do they need, and how do they need that information presented to them? And so, they started off with, oh, I don't want to do a data project. To just being so engaged. When they gave their presentation, we were blown away. In fact, my boss said that was one of the best presentations he's ever seen. And so really amazing to see their growth. They talked a lot about being influenced from their teachers, their peers, their parents. Of course, social media being an influence on them. It was interesting that TikTok did not come out as high as Instagram. And also, they spent some time really walking us through and teaching us how to make a very appealing Instagram or sort of TikTok like video about health careers. And so all of that information is being incorporated into a broader effort for healthcare sector partnerships to look at how do we do more robust recruitment of 8th graders into the CTE pathway. So we're working on that right now with high schools and talking to their feeder schools and picking up kind of best practices and how they engage the 8th graders. Okay. Another big piece in terms of how we're looking to attract students into the health services pathway, we are looking to renovate classrooms in our high schools, especially those that support the health services pathway. So there's about 38 schools. We have a very strong partnership with Hawaii DOE, G70, which is the designer, and 3Rs that's going to help to manage this project. Overall, this will help to support students while they're in the health services CTE pathway with their DOE curriculum and the hands-on learning that they have. We're also hoping that it will be a better transition for the students in certificate programs because it will mimic a real healthcare setting. So transitioning into the job will be much smoother. And then we're also hoping that it's going to be a big attraction tool for some of those intermediate school students as they're looking, or middle school students as they're looking to choose their high school health services, as they are looking to choose their pathway in high school. So The Waianae High School will be our first renovation. You can see here on the left, here is a picture of their current classroom. We're happy that the design has already been completed. We met with the mayor and they are helping us with the permitting and tracking that for us. And we wanted to give special thanks to our funders. So we did have a bill in the legislature funded under HB 1827, funding from our members, as well as the Harriet and Jeanette Weinberg Foundation and Harold K.L. Castle Foundation. We are still looking to raise kind of the last million. And so construction can start in the summer and be done by the end of the year. The second school we're engaging in is at Waiakea in Hilo, and that is in its final design. And so I want to share what those renderings and those pictures look like. So again, take a look at the current state for Waianae. And then this is what it's going to look like at the end of the year. And so you can see here in the back, we have a hospital bay. And so folks can practice. Nurse aid, we have here in the middle a exam room bay. And so that's to support medical assisting. There is also this front desk, which at Waianae, we have a patient service representative course. And so those are the students that take in patients, and so they can practice here. In the back, we have a phlebotomy station. And then what you can't see kind of on this side are a lot of long-term care bays that support CNA training. So there are two classrooms. What we are going to do is create a connection between them. And this is the classroom side, or the second classroom. And you can see they currently don't have cubbies. So we're putting in cubbies here, a lot of usable space. And overall, our program is called Alama Ike Ola, which means to light the torch to health and well-being. So Waikea, I just want to share right now, the Waikea students are working out of a portable. And here's a picture on the left of what it looks like. So you can see there's not a lot of room for all those students to practice their hands-on clinical skills. And so what's pretty phenomenal is that we are going to renovate the library, which you see here on the right. So the entire library space will be renovated, and let me share what those renderings look like. So again, these are in a clinic setting, so exam tables. These are the long-term care bays, practice DNA training. This is the classroom. I don't know how many of you are familiar with the anatomage table, but it's essentially this huge iPad. It's here on the back, and it enables students to really virtually dissect a cadaver and really look at many aspects of, different systems like the circulatory system, muscular system. And so it's really cool. And then this particular classroom will have an anatomage wall. So we also have high school certificate programs in which we are certifying students as CNAs, phlebotomists, medical assistants, and patient service representatives. Last year, we had 105 students in our program across 14 schools. It's not just the certification training, which is provided on campus. In addition to that, they also really study and learn about the job. And then there's a lot of employment support to help them transition into the role. And so last year we saw really positive outcomes, a 98% completion rate, 43% of the participants were Native Hawaiian or Pacific Islander descent. And then we had a pretty strong employment rate of 77% for CNAs. Sorry, I was missing it, 75% overall. And you can see that is a huge improvement from our first year of the program, where we had a 39% employment rate. and I'll cover a little bit more about that. But wanted to provide this YouTube link here to this video so you can see Sweetie Leslie here. Here's her picture. She participated in the Waiakea cohort and was hired at Yukio Okutsu. She was inspired to go into healthcare because of her grandmother. And so you can see her story in that link. So wanted to share kind of what did we learn about those high school students between the first and the second year. What's interesting is that there are students deselecting themselves out of healthcare because they think that that pathway is really for the smart kids and those who are college bound. And so what we need to do is share that healthcare has many opportunities at many different education levels, especially for those who want to go directly into the workforce. For those, and we have a strong focus on CNA, they really don't know what that is and what that entails. So we spend a lot of time walking through the job duties. They go to, so for example, Sweetie went to Yukio Okutsu and got to see a CNA work and job shadow. They go on field trips, they see videos of a day in the life, and then we also have elder care empathy training through the Punahele project. We found, and especially like our first Kauai cohort, that many of them, they say they want to go into an employment and work on island, but many of them just move off island, go to school, not on island, sometimes on the mainland. And so we realized that we needed to screen for all potential options. They're high schoolers. They tend to change their mind a lot up until the end, but we wanted them to check really, I plan to work full-time, part-time, I plan to apply to school on island, off island, and we use that to prioritize students who really want to work locally right after the program. We also found that they were struggling in how to dress professionally. I think in our cohort, we got some feedback about professional dress when the students came to visit the facility. And so we spent a lot of time helping them on professionalism training, how to communicate effectively. We also walk them through how to fill out a job application. So what we found was that students were interested in work, they were excited about employment, and when it came time to the application, they were terrified. And if they didn't know how to answer a question, they just completely stopped the process. And so they really needed someone to sit with them and walk them through. In some cases, it has been a employer that does that. And so we actually stay with them until they hit the send button. And then we find we have check-in meetings to support them along the way. One of our first cohorts, they said they wanted to go into employment, and then by the end forgot that the whole point of the program was to help transition into a job. And so now we have check-in meetings to check in on their goals and help them really along that journey. We also found that a lot of them lack confidence to go into the workforce. So again, our Honoka'a cohort, they made it all the way through. They got job offers from Queens, North Hawaii, and they were terrified to kind of transition into the job. They felt like it was intimidating to go to the big hospital. And so we switched things around, put in a lot more field trips, hands-on training at the hospital. And as a result, the students were so happy, engaged. The teacher said they were talking on the bus ride back. They were so excited about employment. And so wanted to transition a bit and just show you a snippet. So we have former students share about their experience to attract new students, and just wanted to share a snippet from a video where we're interviewing a former student, Tyra, at Waiakea High School. So let me see if I can share the video. We are interviewing her, and so I'm going to show kind of a middle section of the interview.
The class, the program started progressing, I was like, okay, I was like, maybe, I really started like recommending, especially after Healing Medical Center came in, they started talking to the students, being very like open and saying that they, it's like such a like an amazing job opportunity. It really opened my eyes, you know, and I was like, wow, like, you know, maybe this might be for me, you know. You never know till you try. And that's one thing I'm gonna tell you is, you know, you really never know till you try. And I was like, okay, you know what? Maybe I'll just join and I'll just try, you know, see if I really like it, you know. And so like once we started getting into it a little bit more after the lecture and hands-on, I was like, okay, you know, maybe this job might be for me. And you know, as a CNA, you know, you're giving back to your community, you're taking care of other people's grandma and grandpas, you know, sometimes you're all that they have. So, you know, that really kind of opened up like my heart, and I was like, okay, you know what, I'm gonna try it. Because you know what, you never know till you try it, right?
I wanted to go ahead and talk about even the employer transition piece for you. And I know you touched upon that a little already, right?
I did my application online at home, and right then and there, boom, I sent the application in. I came back to school and I had my interview. So the interview, okay, guys, you're gonna be scared, like really nervous. But I tell you right now that 99% of it, like, really, like they reassure you, you know, like they understand that they're still in high school. We're young adults, you know, like it's gonna be scary. And they explain like, you know, the job's not easy. Yeah, being a senior is not easy, but you know, but I guess like I was determined for the job, so like I like put everything into this job, like ending the school year, and I was like, okay, you know, I'm just gonna go for it. They explain pretty much the whole job process to you and the pay, and I'll tell you right now that not a lot of jobs not a lot of people get a state job straight out of high school, and the pay is pretty something dollars an hour straight out of high school. It's not that bad, you know. So just go for it, you know. You never.
I thought it would be really helpful for you to see and hear directly from the student. And so as you can see, she was really engaged and really honest with the students that it's not easy, it is hard, but that is very rewarding. And so she actually worked at Yukio Okutsu, and so I'm very happy. And then she actually took a year off, so she worked during that year, and now she has transitioned back into college. So a really great story. Okay, and so you can see this year, for this school year, we have 17 schools, expanded quite a bit. The program is in school and after school. We have 180 students total and about 140 that are on the employment track. And really, again, this is for high school seniors. So transitioning to the adult population and under good jobs, there was a lot of training offered through our community colleges. As you can see, the grant supports four sectors, of which healthcare is the largest. And we have far exceeded our participation goal. So we are at 152% of that goal. We are slightly short of the Native Hawaiian Pacific Islander participation goal at 29%. And so there have been, actually the number is close to over 700 right now employed. Participants have 6 months to secure employment overall. And so very positive, but we learned a lot of things that I wanted to share. Again, out of those folks trained, 470 were CNAs. And overall, we found about a 34% employment rate. So you could see by the workforce demand and in terms of the needs growing, we're kind of losing ground here. And so what did we learn from it was that the model is where students can go onto the website, they sign up for the training, it's completely free for them. And then they have access and support to, they hear from employers about job opportunities, and they have support through that employment process. What we found was that a lot of students are taking the program because they need it as a prerequisite, or it helps them with their admissions into nursing school and maybe didn't have intentions to go into the workforce, or they're working in another industry and wanted it kind of more in their back pocket. And so what we found was that when the employers had their own cohorts. They found and hired folks in, and then the grant kind of paid for the training. That was a much stronger employment result. So that was in the 90s or 100%. We also found with this particular model and different employers coming in to talk to the students about job opportunities, if those employers did not have an expedited employment process, it would take too long for the students and they would lose interest. And so we were really encouraging our employers. Some of them had on the spot job opportunities and offers, and we found that that was much more effective. And then we have this challenge where a lot of folks, so we have a 3% unemployment rate right now. And so a lot of folks are employed and they're looking for very specific schedules in very specific locations. And so that was very challenging to match up with the job opportunities overall. So just a lot of learning here. I think there still is a lot of value in having kind of these open funded cohorts and having employers have the opportunities to talk to students, but maybe also supporting really employer-led models and changing some of those models for effectiveness. Okay, and so the glide path, I'm going to switch the order here and talk about new glide paths, so 2.2. We are almost there with the lab pathway, which is phlebotomist to med tech to med scientist. So the medical lab scientist program was put online. That enables really that earn and learn, and med tech is medical lab tech at CAPCC is in the process of putting their curriculum online, which will fulfill out the full glide path. We also know our employers also funded under Good Jobs. So like Hilo Medical Center had a nurse aide to medical assistant glide path, which is very effective. And HPH and Kona Community Hospital have entry level to surge tech, and you can see many more here. So in terms of CNA to LPN, and you saw in the data in terms of the high needs for CNA and the challenges there. And so one of the ways we're looking to expand, attract more students into CNA and help them along to fill the LPN needs is through a glide path. And so this started back in 2021 with an innovation team led by HAHʻs. Thanks to My College, which is the hub for this education. We had employers and Hawaii State Center for Nursing participate. And overall, some aspects are that it is earn and learn. And so students, in terms of their education time, they go to lab and clinicals on Wednesday, Thursday, Friday. So the employers needed to free up their work schedule for that time. There are stackable credentials, so they do get credit for their any sort of CNA training as well as their CNA work experience. I'm happy to say that we are also building out the rest of the glide path from LPN to RN, which will also be stackable. Holistic admission. So what we found was that the program was really meant that the RN was built for folks to go and continue on to the RN level. And because of that, the thresholds for the test scores and the grades were at that RN level instead of the LPN level. And so we dropped that in order to increase access into the program, and also folks get credit and more points for work experience, which is different than other education programs. So again, very, very strong employer and education partnership. We have monthly meetings where we're trying to coordinate and align clinicals and work on logistics. And it's just really nice to see that collaboration. And then we also talk if a student is struggling, how to access WRAP services through the education system or at the employer. And what's nice is this innovation spirit, which is when things maybe don't go as planned, it's like, okay, well, how can we change it? How can we support these students that previously did not have opportunities to go into nursing programs because it was so highly competitive, or they needed to go there full time. And so you may have heard stories about Jalen, who was working on Kauai and wanted to go into nursing, went to the mainland, to pursue nursing, moved back to Kauai when she heard about this program just to pursue it. And she is happy to say she's a graduate. I forgot to mention here, this is the Kauai cohort. Jalen is actually this person in the middle on the computer screen because she is on the mainland. This was their first day. And so you can see the future nurses. And we actually have this cohort. They are the cover of our workforce report. And so they really hold a special place in our hearts because we were with them throughout the whole journey. But that was Jalen, and you might have heard about Martha. We've also highlighted Martha in the press. She started CNA training during the pandemic, and then she transitioned into the Glide Path program and is working as an LPN, and she started this at 57. And so it's kind of amazing because we had intended to support like new sort of like high school students along their journey, but what we found was like on Maui, there was a CNA who had worked 20 years as a CNA and was just a phenomenal CNA and always wanted to go into nursing. And then life happened and family and kids and never had that opportunity. And so we're so excited that she's in the program. She graduated through and she inspired her daughter to also go into nursing. So it's those kinds of stories. And I think what we found is that participants are so grateful for this opportunity. And so in 2023, we had 31 graduates. The program offered on Maui, but cohorts on Maui, Kauai, and Oahu. In 2024, we added Hawaii Island. We had 34 graduates. You can see them here on the pictures on the right. And in 2025, happy to report that we have 56 participants and also included Moloka'i. And so other things we learned was that, you know, I'm sure if I asked you folks to go ahead and start doing a standardized test, I'm assuming many of us would not do very well on it. And that's what we found. You know, when you have these folks that have long-term careers, have been outside of kind of the education system, they need support and how to take these standardized tests and get back into that education mode. And so we recognize that and provide a lot of support there. Also, although this is earn and learn, they are dropping to part-time. And so what's been nice is our employers are offering stipends to make them whole in the process. And so what's also great news is that there's a lot of demand. There are a lot of folks who are interested in the program, and we are expanding also employer participation. And nice to see that some of the LPN demand and the numbers, we're seeing results there. So for funding overall, Good Jobs funding, we also worked on a DOL grant, but unfortunately we're not selected. This was with UH. We also have legislative funding from HB 1827 last year and are working to continue that funding under HB 714 this year. And then the last project is really working with Hawaii State Center for Nursing. And so expanding out nurse residency programs. You can see 202 participants, starting up a new long-term care nurse residency program. And then a lot of work on building out new transition to specialty programs. So training up for an ICU nurse or an ED nurse. So these are areas that we saw increased demand during the pandemic. And it's great to see that there has been a positive impact in the data. And so you can see here an ICU or critical care nurse, 107 openings in 2022, down to 47. And so just also wanted to share, this isn't in the workforce report, but wanted to thank the Workforce Funders Collaborative for really supporting this Hawaii Worker Equity Fellowship. And I was at this meeting yesterday. It is an immersive learning experience for healthcare employers meant to foster a culturally inclusive workplace that honors Pacific Islander values. And so we have 3 cultural liaisons. Mona is one of them, helping us to learn about Samoan culture. We also have Josie Howard teaching us about Chukis, and then also Emma Kurashige, who is teaching us a lot about Marshallese culture. And so a lot of immersive activities, 8 employers, 17 participants. And what's nice is that it's not just the learning. Like yesterday, we learned about each culture, and then we went through scenarios and practice, like how would we handle this situation differently. So I felt like it was very, very powerful, and just wanted to thank the Hawaii Workforce Funders Collaborative for supporting such an important effort. Okay, I talked a lot. Here's some links for you at the end, some nice articles, a link to our report overall. I wanted to open up and see if there are any questions.
Super awesome. Thanks so much, Janna. Yeah, if you have any questions for Janna, I know we might be going a little bit into time, but feel free to just unmute yourselves. Just put it on the big screen.
Yeah, I had a quick one for you, Janna. Thank you both to HWFC and for taking the time, Janna, for all of this as well. It's really exciting to see and very educational. I'm a work-based learning coordinator on Hawaii Island. We're the intermediary. And we just started our program in January. So I've been getting up to speed with what the high school academy structures are like. But healthcare obviously is a big focus. Waikia actually neglected to mention that they were building out a huge healthcare facility in their library. They mentioned that they were converting the library, but they didn't mention the healthcare side. I was wondering if you could share a little bit about the capacity for that facility in terms of how many students that they're planning for in their first cohort.
We have a current cohort with them, and what's nice is that all of the health services class participants, so there's about 50 of them, participate in the program. What we've done is, because we've taken over the whole class and they're all going through CNA training, is we screen them to put them, the folks that are on the employment track, which is about half of them, and the folks that are just kind of straight on the post-secondary track. And so the folks that are on the employment track, we're supporting them to help them transition into the job. But overall, I think, as I mentioned you saw the renderings, it can support many more sort of programs, and the capacity can be expanded quite a bit. There's opportunities for different scheduling, and, some of our high school programs, they are done in after school as well. So there's a lot of opportunity to expand.
I was hoping you'd say that. Thank you so much. That's what I'll tell them you said. No.
Yeah.
As you look at the map, right, I think there's a lot of awesome coverage for Hawaii Island. I think especially considering the one in Honoka'a, which I'm very grateful to learn about, because that covers a puka that normally is neglected for Hawaii Island. I would be really interested in seeing what could be done in the Ka'u area, but because Waikia has it on the east side, that kind of precludes then a similar facility at these other schools, just because obviously the main partner is the Hilo Medical Center and the foundation involved. And so I think employer capacity is kind of the issue there. And so it might behoove Waikia to consider how that could be expanded. I'd be interested in how they've kind of managed the instructor side. Is it basically all through Benioff?
Are you talking about the certificate programs in particular, the instructor
Yes.
side? Yeah. So we partner with Island CPR for the instructors. Right now, Hawaii, the community college did not have capacity for the students. So what happened under Good Jobs is they subcontracted under Island CPR. They've been our primary partner there. And we have also, we've had conversations about Ka'u and trying to link and maybe fold in an instructor under them. We are looking to expand into Keau, because we know that there's going to be expanded jobs and medical services there as well. So yeah, I think our model is to really work with both the UH community college system as well as other private training providers. So they come in and they're doing the actual, these are state approved training providers. So they're providing the didactic and the hands-on clinical training for the certificate.
So, and then lastly, I'm sorry, I don't want, if anybody has something else, but it was killing me to just be quiet. But Good Jobs Initiative. What's the long-term outlook there? I've been hearing it might be going away. Is it going to be replaced? Is DOE picking up? Is the ledge going to pick up?
Yeah, so right now, it does end in fall of this year. And UH is trying to expand. So they have plans to really bolster up their workforce development area. But they are still looking for funding to continue to support some of those efforts. They do have some of the positions and the structure in place. And so really looking at the funding aspects now.
Thank you so much, Janna. I appreciate it.
Janna, I have a quick question. With the recruitment activities and events and outreach you're doing for getting more students into the program, do you find that the testimonies of the current enrolled folks in the program are helpful, you know, like with the youth and bringing more of their peers in?
Yes, it's super helpful. We feel like they really respond to seeing past graduates and their peers. And in fact, as I mentioned, we're trying to talk to the high schools and look at how we can improve 8th grade recruitment. And we heard from all of them that they like to see alumni from their school. You know, when we went to visit the library at Waiakea, they have all these posters of their alumni that have been really successful in the community. And I think that really makes an impact for the students.
Hi, Janna, it's Jennifer. Nice to see you. You know, I know that both of us are looking at those entry-level positions, but obviously the attraction of those comes with opportunities to grow in the future. And I'm interested in the glide paths in particular and how employers are responding to that. Where are you seeing employers more open to that potential? And I don't mean by name necessarily, I mean by philosophy or approach, like where you're seeing employers say, yes, we really need to build these glide paths in. I think it'd just be interesting to understand if that's a mindset, resource, both and kind of thing.
Yeah, I think it really has to do with the demand and how much a profession is needed. So in the CNA to LPN, these are two very critical workforce needs. And by the way, the CNA to LPN is not just CNAs, it's really meant for any entry-level position. So for example, Kaiser participated and had techs and medical assistants in the program as they transitioned into LPN. So I think demand is probably the primary sort of driver of the employer participation. And I think, you know, I think they've all recognized that in this kind of work environment that their employees are really looking for opportunities to progress. And so they want to provide that. I also think another factor is really the support. So for the CNA to LPN, there is an entire team supporting. We meet regularly. There's a lot of intermediary support. And so, for example, in that employer meeting, I didn't realize everyone was really nervous for the start of this year. The students were a little bit nervous. The employees were not like, how does this work out? When is the clinicals? But the fact that we could bring everyone together with education and share, here's the schedule. Oh no, that time doesn't work. Okay, let's move things around, or employees are going to have transportation issues. Okay, let's work on that piece. And it was nice to see a month later, I asked, how is it going? And they're like, oh, everybody's settling in. They're really excited. And when the employers was like, I can't tell you how many thank yous I'm getting in a day. So I think everyone just needs some support. And I think that makes a really big difference.
And how does an employer sort of reserve a set number of spots? I mean, can you just walk us a little bit through how that works? For if I am a current CNA at Ohana Pacific Health, how does that work for an individual?
Yeah, so in the UH community college system, they have these like a sheltered cohort model where an employer can buy out kind of seats. And so that's the model we're using for this particular program. And so we know there are a certain amount of seats and we're managing sort of what are the needs and employers that want to participate. And you can see it's not a free ticket. I mean, employers have a lot of work and support. They have to have resources available to support clinical rotations, to support coordinators, and management is involved. And so we go through an onboarding process of saying, okay, here's the checklist of everything that needs to be done and the support that you are saying you're going to offer in this. And so because of that, I think that's kind of why we get such high engagement on both sides.
Great, got it. No, that's really helpful to understand. Thank you. Thank you so much for today and all the work you all do. The data is so important for us to start talking about what's happening and again, where we're seeing changes, which I guess, sorry, I'm gonna be inspired by Dana and keep asking questions. So you said that workforce initiatives seem to be making a positive impact on the vacancy rates. Maybe not the absolute numbers, but the vacancy rates, right? Can you pinpoint where, when, how? Do we have a sense for what we know? Those of us in workforce development, there are a lot of different things going on. What is working specifically?
Yeah, so I think like in those nursing programs are really seeing strong outcomes in correlation to specific job openings. We see it in the glide path for the LPN. It's a little bit harder to see, as I mentioned, for the CNAs, just because that demand is increasing. But as I mentioned, even just for the work efforts we're involved in, we know there's been, hundreds of CNAs trained and transitioned into the job. But we also know that that need continues to grow. So that's a little bit harder to see the impact there. I think we have more room to address that need for the CNAs and the nurse assistants in particular.
Okay, great. Thank you so much.
Yeah, and medical assistants. So those are areas that I know you're strongly involved in. But
Yeah.
please also, I mean, the data is meant for like you folks. If you need it to justify and to help to get, funding, by all means, if you need help in that, let me know. That's what it's really meant to support the entire healthcare industry, continuum of care. We're not trying to do everything ourselves. We feel like we're the incubator and trying to test things out. We'll share what we learn with, but we need all of us working on this because you saw that we all need to be working. We all need programs. We all need to help people get into employment. Like everyone is needed in this effort.
Thank you. And on that note, thank you so much, Janna, for your time today, and also Coco for setting this up, and also you guys for joining us. I know that was a lot of information, but it's also very empowering and just hopeful, just seeing a lot of our youth wanting to get into the healthcare industry and bringing their peers along. Yeah, Matt just shared a note over here. But just a few quick housekeeping opportunities. I know we have a lot more questions for Janna, so if you don't mind putting them in our post-webinar survey form, that'll be super great. It'll allow us to help follow up with potential other discussion and meetings in the future. Also, if you're interested, we have another webinar coming up next Friday. Go ahead and register for that. We're going to learn about the workforce challenges and bright spots in our wastewater sector with Gabby Zemmer from Y. And then we will share a lot of the information and the links and resources that Janna shared during her presentation will be sent out in a follow-up email. So we'd love to hear from you. Thank you again for joining us and spending your Friday morning with us. And ahui ho, safe weekend. Thanks, everyone. Let me just stop the recording.